Welcome to the SKE podcast. I'm absolutely delighted to be joined today with Kate Redding and Lisa Knowles. Hi, Kate.
Hi, Siobhan.
Hi, Lisa.
Hello. Hi, Siobhan.
So we can't wait to hear all about Perio Life Align. But before we start, we hear about that. Can we just go right back to the beginning? And I'm going to start with you, Kate. And can you tell me a little about your learning journey? Where did your learning journey start? And tell us a little bit about it.
Well, I've always enjoyed doing CPD. I've always been involved in societies and going to courses and doing webinars as they become available, and really enjoyed CPD. I went on in about 2019 and did the BSc in dental studies at UCLan, which I absolutely thoroughly enjoyed. And I was sort of looking for something more to do. It gave me a bit of the bug, and I wanted to advance further, but I wasn't really sure how. So I was looking into doing a master's, but I still felt a little bit nervous about my academic skills. Wasn't really sure I was ready to go to master's level. And so I was looking for courses, and I was on a holiday on a sunbed, if you remember, Siobhan.
Yes, I do.
Causing mischief in my own mind and looking through what I could do next. And I saw your diploma come up. I was days away from signing up to a different course, and I saw the advertising for the postgrad diploma in oral and positive health, and I've never jumped out my sunbed so fast. I ran to my husband and I said, "Look, I found it. I found the course I want to do. It's perfect." So I was absolutely super excited. There was so many areas that it ticked. It was exactly what I've been looking for. It was, I felt really anxious about my academic skills. And it was really great that there was a whole unit to improve my academic skills. Words like analyse and research would be words that would terrify me. Academic writing.
Yes.
So there was that straight away that attracted me. And then there was also all the other content about, our clinical skills and advancing my dental knowledge beyond. So it just ticked all the boxes. So I was super excited.
I remember you messaging me. And honestly, like we just put the course out and it was launching, and of course nerves were kicking in. And you were saying, "Are the places gone? Would you keep me a place?" I was going, "Oh my goodness, of course you can have a place."
All I could think was, I've not brought any money with me apart from my basic card for being on holiday. Who's the place?
Oh, no, Kate, honestly. And yes, just going back to that about academic writing, why I put that in there, because when I went back myself, oh my goodness, I didn't know where to start, and I didn't really have a lot of support. And you could go in on workshops, but most people had done something like that before, and I definitely hadn't. So it's interesting that you went after that. Yeah.
I think that's the thing, is because when I qualified all those moons ago, you didn't do any of those sorts of skills, really. I did the diploma, so we didn't learn those skills. It was very...
Yeah, we didn't.
No, it was hands-on, and we learned the lectures that we were provided, but I didn't understand any of that terminology.
And funnily enough, it was something you really wanted to get right in the course, wasn't it?
Yeah.
And so you did the diploma in oral and positive health,
Yeah.
and absolutely thrived, I would say. Then you came back for another course, so we must be doing something right.
Yeah, absolutely.
So you came back and did the coaching. So going back to that academic, what do you think about that writing now? How do you feel about it now?
It's absolutely changed the way that I feel as a clinician, in terms not just of my confidence to actually perform those skills, to be an academic, but also to understand to understand about papers, about what is important about a paper, the hierarchy involved with papers, to understand the research methods involved. So I just feel that I'm a world away from where I was when I started the course. And just being able to have the support, I was so lucky to have the ladies on our first cohort that we did. They were such a fabulous support, and yourself, Siobhan. And so to sort of be able to say, I really don't understand what that is, and for everybody else to say, "Oh, I feel the same," and to not feel out of your comfort zone, and to feel you had that that learning journey with support was amazing, and encouragement.
And that's actually continued with each cohort. So everybody's are all very supportive to each other and always willing to help and give a hand and, and just share the experience and the overwhelm around the assignments and everything. So yeah, that's lovely. And Lisa,
Hello.
Did you look at the course or did Kate drag you in to come and do the course?
So I did the coaching in lifestyle medicine. So I suppose it started with me quite a long time ago. So my background actually, I used to be a figure skater way back when. And subsequently, my daughter used to skate for GB on their development squad. So for us, kind of wellness, health, lifestyle, nutrition, mindset, inflammation, recovery, all that has always been a thing. So when I went to uni and did my oral health science, and we started talking about not so much openly and honestly prevention in those days, because it wasn't, but we're talking about prevention, we're talking about inflammation, we're talking now about the body as a whole. And these dots are kind of everywhere. And I was looking for something to connect that.
Okay.
Obviously, Kate and I get on really well together. We work together. And this was something I kept going back to her. Anyway, Kate put me in touch with you and the course. And I just thought, you know what, this is exactly what I need right now. Two small children at the time, life's busy, but actually it fitted into my life, my working week, family life, and it's perfect. It was exactly what I needed. And now I feel the dots are connecting. And then from that now I feel this is where Perio Life Align is, and that's it. We're evolving from where we were with the coaching course.
Amazing.
And it's great. Really positive.
So, drum roll, Perio Life Align. Oh my God. Every time I see it, everybody's asking me about it. Every time I see one of your posts come up, like I couldn't be more proud than what the two of you have achieved and what you've implemented in practice.
But it wouldn't be without you.
Tell us a little bit about it. Who wants to go first? Kate, do you want to start? Tell us a little bit about Perio.
So after we'd finished the certificate in lifestyle medicine coaching, we had all this knowledge and we just wanted to know how we could move this knowledge forward, really. We were, as Lisa says, we've worked together for about 8 years and, we're constantly on the phone to each other texting, what do you think to this? What do you think to that? And we just wanted to build something that was a little bit more. So we talked and we decided that the best way to move forward was to create a social media platform, which again is completely out of our comfort zone. We just thought together we can achieve this. So we built Perio Life Align, which is a social media platform. And the idea, it really is, it's early days, and we're sort of just going with the flow with it. But the idea is it bridges periodontal disease and periodontal health with lifestyle medicine. And we just want to get the message across to try and educate the public, to reach out to our dental peers, and just sort of, highlight the connections and the importance of systemic health, periodontal disease, oral disease, and just the fabulous way that lifestyle medicine can really approach all this.
Absolutely. And Lisa, going back to what you said before, sometimes it's very difficult to express the content. And that's why we put this podcast together of what we do in the course. And maybe we haven't titled it correctly. I don't know. It might be something we need to revisit. But Lisa, going back to inflammation, really, I suppose when we started this course and when you did the courses, there probably wasn't even as much about, the fast foods, high processed foods, inflammation in the body. Can you notice a shift in it now at the moment? Like even in the last few weeks?
Absolutely. And I think there's more, general awareness in society. There's more emphasis on prevention these days. More people are more aware about their general health, their overall health, but linking it back to the oral health and disease and health, it's bringing it all together. And that's that little light bulb moment when that patient goes, I didn't realize that. Mm-hmm. But it becomes real. It becomes real life. It becomes actually quite relevant to them. And that's the change.
We are in such a position, and every contact counts, and we do see patients regularly. Tell us now a little bit how you implemented, because I do remember when you brought a proposal to the team, to the whole practice. Tell us a little bit about that.
After we decided that we wanted to really implement lifestyle medicine into our daily appointments with patients, we're very lucky we both work in general practice, but we work as colleagues in a specialist referral practice. So we're really, really lucky in the position that we were in terms of the support that we're offered. So we decided, we said to our colleagues, we're going to start doing lifestyle medicine. They were like, what's that? So we thought, right, we'll take this back to the basics.
Here we go.
Yeah. So we decided to have a team meeting, and Lisa and I did a presentation on lifestyle medicine. We talked about how we would implement it in terms of appointment times, the costings, and the barriers that we might face with patients within the team, any challenges that we might have. So we decided just to go with the team and see, and the support we got was great, wasn't it, Lise?
It was, yeah. I think we doubted ourselves a little bit at first, thinking that even some colleagues, I suppose, some members of the public kind of thought it was a little bit wishy-washy, but actually, as we've presented our evidence that's already out there, we're justifying why we're doing things. Again, they're fully on board, fully supportive. So yeah, it's been great. Seen a massive turnaround, haven't we?
Yeah.
And what about your patients? So tell me, could you tell me a little bit what an appointment looks like? So I know they're probably different for somebody that first comes along, or maybe tell us first about maybe a first patient, and then tell us how did you implement that for a patient that's perhaps in maintenance or continuing care?
So I think for the initial patient, we talk to them about lifestyle medicine from the offset. We talk about medical history. So of course, naturally, that's going to bring up smoking history, alcohol, etc. But then we're elaborating on that, then bringing into more of a discussion. So we then go through a full lifestyle questionnaire with them. We can then go on, we do HbA1c testing, and then again, talking, it's the conversations, it's that communication that we've got with the patients, bringing out different connections, kind of making them realise the little dots can be joined up, and then kind of going through how we're going to implement the lifestyle pillars basically into their lives and making it easy and actionable for them. Over time, with maintenance patients, we're revisiting those pillars. So we're looking back onto the questionnaire, we're revisiting it. We might not revisit every little point at that moment in time, but we're kind of praising them on their achievements, on their wins. We're going back and we're trying to focus on something small again that we could help them, help them change in terms of their lifestyle to reduce their risk factors overall. So yeah, the maintenance patients, that's continuous. We just revisit each time. And, you start to build quite a catalogue of, that patient is a lot deeper, and there's a lot more to that patient than actually what we ever knew. We might have seen these patients for a long time, but actually when you start implementing this lifestyle questionnaire, some of the information that comes out of it is incredible that we never knew.
Yeah.
And that's the difference.
And I think that's the really interesting thing. I feel, because obviously we learnt the coaching skills as well.
Yes.
I feel like my ability to discuss things with patients has become much more efficient and better.
Okay.
I always had, me, I'm a bulldozer, and I always like to fill a space and can never shut up. So to learn the skills of active listening, creating SMART goals, creating action plans, not being the advice monster and telling them what I think they should do, because that was my priority. Tuck away my bossy self, put in my professional self. But when you're chatting with patients, the information, and some patients, when we first created the screening tool, we sort of played around with the questions with some maintenance patients that we felt comfortable to discuss with.
Yeah.
Ask for feedback. And it was so interesting, patients that we've been seeing for 4 or 5 years, and the the feedback we got from them and the information we learned. So you just feel all of a sudden you know a lot more about a patient's priorities, about their health, about their stress levels. And without getting too deep with them, obviously, you know, there's always that barrier and that cut-off point. But you can have some really interesting chats, and just for us, I feel we're just getting a much better result from patients because they really understand where we're coming from.
What's been the feedback back to you from the patient?
Well, we had a lady who came in. I had a patient in who was a maintenance patient, and we've been treating her for some time. And I went through the questionnaire, and she'd been pre-diabetic the whole time and had never filled it in on a medical history form. Hadn't felt it was important because it doesn't say pre-diabetes on the medical form. It just says, "Are you diabetic?" And so when we really started talking about the relationship between diabetes and gum disease, which we'd kind of talked about briefly, but when we got into the pillars in more detail about diet and ultra-processed food, and we looked at the diet, and we analysed what she was eating, and we looked at exercise, which I think is really interesting with people, and sort of lifestyle. She just couldn't believe that all this was so interlinked. You know, we always sort of back up each pillar with, you know, did you know ultra-processed foods does this to the body and to the gum?
Yes.
Or to, you know, so we always sort of back it up to make it relevant to patients. But yeah, so just great feedback. You always get one patient, don't you, Lisa, that's a bit resistant, but
always.
Yeah,
I just want my teeth cleaned. Is it?
Yeah.
But you know, generally it's that kind of interviewing technique. It's non-judgmental, and we do, you know, we're not having a go of them. No, those days are gone, aren't they? And they are quite receptive.
Yeah.
But I think it's the difference with their overall health. And like I said, you know, before, when they connect everything together and they're seeing the physical benefits of maybe walking briskly for 10 minutes every day. You know, it's the outside space, it's the fresh air. It's all of that they can physically see. That's the feedback I'm getting. Happier patients, therefore compliance is a little bit better. They want to do more in terms of looking after their diet, their oral health. So it all comes back to hopefully successful long-term treatments.
Yeah, and living to be beyond 100 and in full health, all our patients. Yeah, because the thing is, we're healthcare professionals, so we know a lot about health, and I probably did assume that my patients often knew a lot more than they actually did. And it's quite amazing, isn't it? And the feedback, they're very grateful to get this information and for people that are genuinely interested in them.
Yeah,
they are.
I feel the lifestyle medicine as well, because of the pillars, it really does give you a much more structured approach to talk to patients. Because, you know, we all know, you know, if you have somebody come in the surgery and they might, you know, you could tell maybe they don't exercise enough, or they maybe, you know, they could do with losing a few pounds. And, you know, it's very difficult to broach that. But often when you go through those questions, or you can tell that they've got a stressful life or they're not sleeping properly, it really gives you a structure to sort of approach with them. So I find that a really useful way to sort of to go through this information without making out like, hey, I'm just being nosy.
Yes, that you're not just making it up, basically. Yeah. So, and then you've been asked to speak. You've been asked to write articles. You've been asked to present now at some conferences. How does all that feel? What do you think about all of that?
Scary. Do you know what? I think on a personal level, it's great because it's taking us out of our comfort zones. And actually we're realizing that we are pretty capable of speaking to more than just each other. So yeah, no, it's a really positive experience, and we're just trying to take every opportunity that we can, I suppose.
Yeah. And it's quite overwhelming sometimes.
Yeah.
It's so out of our comfort zone. But if we don't push ourselves to do that, then, you know, we'll never do it. We'll never do it. And we feel so lucky to have done the course with you, Siobhan, and to have all this opportunity and to have this new knowledge, and to just so passionate to spread the word and just to help push the message out further. You know, we feel really, really lucky.
Oh, well, honestly, just watching your journey for me is such a privilege. It really is. And can I mention your mum, Kate? That is absolutely your number one fan. She came up to me at the graduation and she said, I just want to tell you my daughter's thriving and she's loving watching your journey. And it was funny because at the time there was something happening with the computer. My brother-in-law was there and he was just helping me out because he's good with technical. And he said, oh my God, it was amazing to hear the mother speak like that about the daughter. You know, it was really touching. Is she still on the sidelines? Yes.
And my stepdad is a fabulous support, Siobhan. And with my last assignment, he always proofreads them for me. And he said, I'm glad that you finally learned how to write because it would take me hours before, and now it's quite a quick job.
No, that's an achievement.
I think they're both grateful to you.
You did it, Lisa. You did it. Okay.
Oh dear.
So what's next? I know you've written some articles. You're asked to do a big one, which we're not going to tell you about, audience out there, because it's coming up, but it's quite a biggie. And you've got some speaking slots, and the world's your oyster, basically, isn't it?
Yeah,
I think we're busy. I think this year so far, aren't we?
Yeah.
Busy. What advice would you give to somebody that's contemplating coming on a course at SKE?
Don't hesitate. Do it.
Yeah. And believe in yourself, I think, as well.
Absolutely.
I've never had the confidence. You know, I wasn't massively academic at school. It isn't something that comes naturally to me. I really have to put the hours in and the effort in. But I just think with some commitment and belief and really wanting it, and as you always say, Siobhan, pushing yourself out of your comfort zone, it's the best place to be. Yeah. That's why we're here.
That's what the three of us are doing that today on this podcast, aren't we? You know?
Absolutely. Actually, it's actually quite refreshing to go back to learning, isn't it?
Yes.
I mean, we're constantly doing CPD, we're constantly learning, and that's what it's all about. But it is actually quite refreshing to go back and do a course.
Yeah.
So
yeah, and that's interesting as well, Lisa, because it's not a CPD course, isn't it? You know, because you can go on a CPD course and you can learn and you can give back your answers and you get your certificate. But this is about your interpretation and about going and doing the research, but also having the skills to continue that, because clinical practice changes every day. We need to know where to go and look for that evidence. So I think that's hugely important, isn't it, to keep up those skills?
Definitely.
Yeah.
It's helped our practice massively, hasn't it? So
yeah, and it gives you much better job satisfaction, and you just feel your worth a little bit more. You know, people really listen to what we're saying at the practice more than ever, and our knowledge is so up to date, and we've got all the evidence to back it up. And I just think that's a great position to be in.
And Kate, was it you that said one day, actually, a colleague came into the room and they didn't have the right evidence, and you went back with confidence with the evidence? That was you.
Yeah, I found the case study on the postgrad diploma absolutely fabulous, because it really is about what we're doing every day, and proving that what we're doing is the best that we can do in terms of evidence. And so I was fresh out my case study, and I can't remember what it was about, but I said, "Oh, I've got it."
Yes, I love it. I've absolutely loved having you on here, and I'm really looking forward to doing more work with both of you as we go forward. Thank you very much for taking the time, because I know that you're very busy. So will I get one little word of advice from each of you out to the audience? Kate, go first, maybe.
Believe in yourself and push yourself.
Amazing. Lisa?
Just do it.
Yeah.
Just do it. Don't hesitate.
Just do it.
Yeah, just do it.
Thank you, Siobhan.
Thank you, Siobhan.
Thank you very much, both. And thank you very much for listening. And we really appreciate it. And if anybody's interested, go to SiobhanKelleher.com, have a look at the courses. Kate did the diploma in oral and positive health level 7, and she did the certificate in lifestyle medicine coaching level 5. Lisa did the certificate in lifestyle medicine coaching level 5 as well. And take care, everybody, and we'll see you on the next episode.